Welcome to the Pinoy Nurse podcast, showcasing inspiring stories of Filipino nurses worldwide. My name is Dion Candelaria, and I'm your host for this episode. I'm very excited today to have on our podcast Dr. Tootie Bueser. Let's let's go. You've done a PhD and held national leadership roles and worked in inherited heart conditions. Uh, I'm sure many of us were wondering what inspired you to go into research. Research is not always something that a lot of nurses go into, or at least a lot of Filipino nurses. So, what advice would you give to nurses who are curious or unsure about where to start?
Yeah, I think I got into research. I mean, as even when I was young, I knew I was going to be in a field which has a research element to it because my parents were both academics, and
Ah,
there was always this sort of the buzz of doing a study, experimentation, and all that that was going on as I was growing up. So I knew that it was something that advances science, advances the quality of our lives. Um, so that's instilled in me since I was a
mhm,
child. And so I became a nurse. But I guess the first thing about research is just to make sure your practice is evidence based. So just you go back to the literature, making sure your nursing practice is sound and evidence based. But when I really got into research was when I was a inherited cardiac conditions nurse,
mhm.
where I was looking after patients who had experienced sudden cardiac death, and they were not only concerned for the patients not concerned for themselves when they're diagnosed with an inherited cardiac condition, but also for their families because
Mhm.
um, these can first degree relatives can be affected. So there was a lot of the kind of medical care around that, but also the nursing and psychological care that was required to support these families because these are chronic conditions and people are living in fear of this sort of sudden death that might happen to them. So I saw obviously a gap in practice that people were thinking about, how can I be supported, or how can they be supported well psychologically? Um, and people saying I need psychological support, but what is that really?
Mm,
What type of support do you need? Is it
yeah.
somebody to talk to, a nurse, actual input from a psychological profession. So that was what I studied really is what kind of support people with a new diagnosis of inherited cardiac conditions or new carrier status for genetic disease in cardiac, and how best to help them. Um, so that's where my sort of wanted to do my own research kind of started. And I think if you're a nurse and you want to get into research, find something that you're passionate about,
Mhm.
something that's really, really interesting to you, because you're going to invest a lot of your time and effort on this.
Yes.
So I think it's what makes you kind of wake up in the morning,
Yeah.
and what you feel is also missing in the
Mhm.
care of the people that you're looking after. Or it could also be what is it within your teams, what is there, the dynamics there, some sort of elements that might help teams, nursing teams, or the multidisciplinary team work better. So there's so many areas in nursing. It's I think
Mhm.
the dilemma is really where to which topic to start with. But certainly for me, finding a topic that you're passionate about, that you feel that there's gaps in the evidence, and also then finding a mentor or somebody you can bounce off ideas on to get yourself started in research.
Very well said. And I think uh, finding something you're really passionate about is really is really important. Of course, I could relate, and also it's something you're gonna be thinking about day in, day out. You're gonna be kind of uh, reflecting on what changes you can make and what contribution you can make. Because you want your research to be impactful as well, and you wanted to uh, have a big impact on patients' lives, or on in my case in health systems and in teams, as what you've said. Um, right. So you spoke about how grounded your research is in inherited heart conditions. Uh, and again, that area is very niche. It's quite new or unfamiliar for many. How did you get into inherited cardiac conditions now? And why do you think genomics is interesting or important?
Yeah. So I think you probably will not come across an enthusiastic person about inherited cardiac conditions, ICCs, and genomics. And so it started actually again with a patient. So
Mhm.
I was a cardiac rehab nurse. So,
Oh, really?
yeah, I was. And a patient came to me and he was diagnosed with an inherited cardiac condition. And and then I knew that there was something that I needed to kind of know about in terms of how to support his exercise. You never tell people not to exercise,
Mhm.
but in some cardiac diseases, you might actually have to advise them to modify their exercise
Mhm.
and tailor it to according to their condition. And that stumped me because at that time I didn't know what to do for him. I didn't know
Mhm.
how to work with him. But thankfully, the patient was actually an expert patient. He was a member of Cardiomyopathy UK and actually educated me on his condition. And then so I was able to look up, okay, this is what I need to do, how we can support him. But then so that initiated my interest in inherited cardiac conditions because
Right.
it's something I didn't know and wasn't familiar with. Um, and then the British Heart Foundation, which is a big charity, a research charity in the UK, they funded the first cardiac genetics nurses, and I applied for a position in London, and thankfully I got it. And
Mhm.
it kind of grew from there. So we started the clinic quite a few years ago now. It was just me, a consultant, and a genetic counselor, and a clinical geneticist, and that grew from like 2 clinics a week to now. There's clinics sometimes twice in a day.
Wow.
More nurses now in that team, and we cover not just a sort of hospital catchment, but now we are supporting a whole region um, of services for inherited cardiac conditions. So that's really it's grown from there. And as a specialty, inherited cardiac conditions nursing is now becoming a bit more sort of known, and
Mhm.
then we're now going into the next stage where we really need competencies to
Credentialing
make sure
and
yeah, and to
yeah.
make our practice sound, but also our own sort of contributions and roles to the care of the patients. what
Mm.
what is that specific thing that nurses bring to that? How can we improve it? And then in terms of genomics, obviously the it's a big element of the care because
Mhm.
your some of the genomic sort of um, characteristics or the genetic sort of changes that underpin the condition
Mhm.
that then kind of helps you decide how you manage the patient or how you give them advice and about exercise and all sorts of things. So that is a big component of that, to be able to understand that. And then, of course, to support patients as they have to communicate to their
Mhm.
family members that they may be at risk for this condition, and then the ongoing care for those family members. So it's a very exciting field. There's it's kind of, to me it seems a bit sort of more mature now because I've been in the business for a
Mhm.
longer time. But in terms of general cardiology and general knowledge about these conditions, I don't think it's that commonplace. So there's more work to do around that. Um, yeah, and I think as nurses, it's really important for us to know about genomics in our own roles because it's all applicable, not just in
Yeah.
cardiology, but also in pediatrics and cancer,
Mm.
all sorts of, even in general health, genomics plays a huge part. And so I think whether you're working in public health, the acute care in the community as a nurse, I think it's important for us to learn about how it applies to us in our practice.
Wow, fascinating. And I think as I was listening to you, it also has got to do with how the science moved forward, right? Like now we know
Mm-hmm.
more and more, like the genomics as a field in general grows and matures, as what you said, it evolves. Um, and certainly there are specific gaps in terms of what nurses can contribute in that growth. So you're definitely in the right space, combining, the science and your passion. But also the other thing that I got from that is it's interesting to see how it started with a patient and your curiosity with your interaction with that patient and 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 you kind of nurtured that and that's what kind of
Yeah.
it's like a seed that you watered and now it's grew to be this fantastic career. Um, Now let's talk about your involvement in within the Filipino community in the UK or in London. So you're one of the uh, founding members of the Filipino Senior Nursing or Nurses Alliance. That always stumbles me, like Senior Nurses Alliance. Um, can you tell me the story of how it was, what was the impetus for you coming together and building this alliance of Filipino senior nurses? And yeah.
Yeah. So I think so I can't claim to be a leader in this, to be fair. I think the true sort of pioneers of this alliance is Jenny Kagia and Louis. And this all started I think in COVID times where there was a lot of Filipinos who
Mhm.
were impacted and died because of COVID. And I
Yeah.
think that was the only time really that it came to light how
And
you know
disproportionately so as well.
disproportionately, yeah.
Yeah.
And so this just came to light how much we suffered, and
Mm,
actually have been a quiet sort of majority in terms of the international nurses working in the UK. And I think I think it brought to light the need for more tailored support, recognition of the hard work that we've been doing here, and also the sacrifices we make because we are, most people are far away from their families.
mhm,
So, so I think that's where it started, and these two people who I've mentioned earlier, they managed to get some very significant roles within NHS in England that allowed them to kind of gather the troops, so to speak, and seek out people like myself who were kind of in some ways waiting for that sort of momentum and connection.
mhm,
Because I mean, in my work, I tend to be in isolation as a Filipino nurse, because you might understand this in specialist nursing that you
mhm.
tend to work in very small groups or in isolation. So there wasn't a
Very
lot of that.
autonomous
That
roles as well.
yeah, yeah. So there's not a lot of that connection with others, and and my involvement in the Filipino community, because I used to work in a different hospital where we were much um sort of closer. But when I moved to London, I kind of became detached from that wider
Mm,
Filipino community within the hospital, because they weren't the people I kind of worked with for a long time.
yeah.
So that was the impetus for that. And so whilst COVID was very tragic to our community, it also brought about these positive things. And this is where it actually came to light. There's only a handful of people in senior leadership posts in the UK for nurses,
Mhm,
and I think that's where we decided actually we need to encourage and support the nursing community to have a voice, to support people. So we've gotten to a particular position. How can we support others to get there as well, and then to also make sure that people who are um, our leaders in the National Health Service
mhm.
also see this sort of the talent that the Filipinos have. So the Filipino Senior Nurses Alliance is sort it's because we have what they call sort of banding here in the
Yeah.
UK in terms of in terms of your seniority as a nurse.
Hmm.
So it's initially it was from 8B to above, and we started 8, and we started band 5. So this is 8A, and now it's 8A and above. So it's now a bigger group, and we work very hard to make sure we try and get some mentorship
Yeah.
going. Um, and also sort of supporting sort of education opportunities, career sort of opportunities, and that's really sort of us sort of trying to support our juniors to kind of get them to more leadership posts.
I think that is a really fantastic initiative, and it's so noble as well, when you are uh kind of lifting
Lift as you
the
rise.
yeah, lifting as you go up, like you
Yeah,
take Filipino nurses with you as you go, and also mentor and nurture the talent. I think that's very important. Um um so you mentioned about your involvement in other things. You're an education committee member of ACNAP and very active with ACNAP, and of course that's where we first met in Edinburgh. Um, and you've held editorial boards and senior, your chair for other organizations. Um, so in your leadership journey, what have you learned about building your influence and using that influence or using that voice as a nurse to create change?
yeah. I think to be able to influence is really you've got to be credible. And I think you have to have that solid grounding in terms of your training, your knowledge, or whatever it is you're passionate about or want to be an advocate for. So make sure, yeah, I've always tried to make sure that I have solid grounding in that. And that's why I'm always a student. I might have finished the PhD, but I'm continually always learning
Yeah.
because that credibility and that solid ground, allows trust in you, that makes you sort of able to have the confidence to speak out, and not just for yourself but for others. So I think that's really important, that to have that solid grounding and credibility. Now, once you know, it's getting to the table, isn't it?
Yeah.
To make sure that you're, on. Let's say you've got your sort of collective voice that you're trying to amplify, and that's getting to the table, and that's about, you know, um, networking, having
Advocacy.
allies, advocacy, having allies in sort of the key positions who,
Hmm.
who invite people to that table, so to speak,
Hmm.
um, so that you can then have that strong voice there. And I think it's actually very important to involve. I mean, in our work, we try, like for example, in genomics education, we try to involve students, qualified or registered individuals, and those within the sort of hierarchy in that, up to the chief nurses. And so we listen to all these, that collective voice. What are the challenges? What are the needs? What works and what doesn't? And actually, when then we bring it to people who commission work or support or able to kind of make decisions on how to support genomics education, we bring those voices with us. And
Oh,
I
okay.
think then that sort of, gives you that sort of kind of, you then have that diverse representation of
Yeah.
people,
Mm.
and their opinions to bring across. So I think try to be, if you want to be a good leader, to just be as inclusive as you can in terms of the voices that you are bringing to the table, because at the end of the day, that's you kind of distilling people's passions, desires, and sort of frustrations
Hmm.
into sort of like, a 10-minute pitch to people
Yeah.
who will then fund and how to support, how to resolve these challenges. So I think that's key.
That's a great note on leadership. I mean, I've never really pondered it to be that way, that as a leader, your voice is, as how you explain it, it's kind of a combination of all of your team members' voice, good, bad, or whatever. And it's up to you to kind of distill that and pitch it, as what you said, to
Yeah.
policymakers and those that can really make change.
Yeah, I think it helps form your vision as well because,
Hmm.
you probably have inherently something that you're sort of aspiring to because of your own sort of beliefs and things that you feel need to change. But with all everybody else behind you, I think it just makes it stronger. So that's why it's always important to have lots of what they call stakeholders in
Hmm.
the arguments that you're making.
Yeah, you need to be a good listener if you
Yes.
if you were to be a leader, isn't it? Um, so we're nearing the end. So throughout your journey, Tuti, what has helped you stay passionate about nursing and being a leader while we're talking about leadership?
Yeah, I think nursing is one of those professions where it's never boring. Every
Mm,
every day is different. It brings different challenge, and there's so much happening in health uh, and technology now. So I think it's keeping us on our toes. So
mhm,
I remain interested. I remain passionate because there are still, I guess, not everybody has access to the same quality of care. So you want to work hard to make sure that everything is fair and equitable, even if it's just in your own space or the patients that you care for. So I think that's what drives me as well is making sure everybody gets good care.
mhm,
And then what makes you excited is of course, there's so many new things coming through, like better knowledge about conditions because of genomics, gene
mhm,
therapies, clinical trials that are targeted to specific genotypes. And
mhm,
so that is what's exciting. And then trying to distill what's the nursing role in that? How can we contribute to make sure that that's translated as quickly as possible to routine care, and
mhm.
that actually we then are able to cope with the impacts on that in our practice, but also for patients and families, that they are also able to understand and get through these sort of new things with as little sort of discomfort and challenge as possible.
Right. That's a good. Um, Now we have one question that we ask everyone, all of our guests, and I'm very keen to know, what is one piece of advice or wisdom that you'd like to share with your fellow Filipino nurses around the world?
I think probably stay true to yourself. I think that's probably one thing that I'd particularly those who when you travel abroad and you work abroad, I think you get a lot of sort of influences, or you're made to change a particular way that might not be the same as your values and things like that.
Mhm,
So I think staying true to yourself will help keep you grounded. So
mhm,
whatever ups and downs you have, you can always come back to that and sort of kind of reflect and see what the next steps are. But also it keeps you as a nurse, true to what you kind of set out to be in terms of your work ethic. And I think that's always important because you'll get challenges, or you'll get people trying to make you behave certain ways.
mhm.
But I think staying true to yourself um, can help you stay resilient, but also you've got those core values that we have as Filipinos,
Mhm.
that can see you through a lot of the challenges that we face.
Beautiful, beautiful. Values and integrity, isn't it?
Yeah, definitely.
All right. So thank you so much, Tuti, for your time and for your insights and for sharing your journey and your passions and interests in the world of nursing and research and genomics. I'm sure our listeners were inspired and were hopefully motivated to do research as well. And yeah, thank you very much, and I wish you all the best.
Thank you so much, Dion. And I really would encourage nurses to take up research careers. Very rewarding, lots and lots of opportunity. And if you're a Filipino nurse as well, leading your research, you bring a different perspective, and actually,
Absolutely.
and I think it's all the better for it to have that kind of you know diversity and sort of viewpoints in terms of research. So thanks so much for having me.
No, it's a pleasure. It's a pleasure. Um, all right, stay tuned for more inspiring stories here at the Pinoy Nurse podcast. And again, this has been Dion Candelaria. Thank you and goodbye.